During 2020 and 2021, we have all experienced the use of electronic devices such as tablets, computer work, and also the use of smartphones. That working distance is about 16 to 22 inches, which forces our eyes to focus at that particular focal point. We have to remember what is going on with the eyes. Specifically, eyes have to converge, the pupils have to become myotic or constrict, and the natural lens of the eyes bulges forward to focus. And that induces what we call accommodative spasm. Okay, so accommodative spasm then in turn can induce eye strain, and that can induce the red eyes, the dry eyes. And in addition to that, we have to remember that our blinking rate decreases when we are looking at electronic devices. Normally, we blink about 20 times per minute in a normal conversation, one-to-one. However, when we are using those electronic devices, our blinking rate diminishes by a quarter of the time. So we blink about 5 times per minute. That in turn, it's getting rid of or evaporating the lipid barrier, the lipid layer that is protecting your eyes. Our eyes are, in essence, able to focus at all focal points, but when we are at that working distance, they're not used to that, and that's what induces the strain. Let me start by answering that in a number of ways. In reference to electronic devices and iPhones and tablets, like we had mentioned, preventative care would mean that you need to take breaks. I normally tell my patients to follow the 20-20-20 rule. Every 20 minutes, for about 20 seconds, observe an object that is 20 feet away, and that allows your muscles to relax. In reference to other preventative care, in reference to ocular surface dehydration, we need to start working on topical eye drops, preferably over the counter, that are preservative free. And those will tend to lubricate your eyes and your ocular surface. We must also talk about spectacle lenses with blue blockers, because there is a lot of blue light that is being emitted by electronic devices. You need to see an eye care specialist to determine if you have astigmatism, if your eyes are not the same refractively, so you can accommodate at that working distance. In reference to overall eye health, please consider your yearly physicals with your primary care physician. We must rule out diabetes, hypertension, high cholesterol, autoimmune disorders, thyroid disorders, and any type of systemic condition that can lead to severe dry eyes because of systemic inflammation. Preventative care also includes taking good care of yourself, not smoking. Avoid secondhand smoking. That introduces free radical damage, which can cause or accelerate the progression of cataracts, macular degeneration. A good, healthy diet. You must eat vegetables, fruits. Those are antioxidants, once again, that prevent against free radical damage. Incorporate more fish in your diet, more omega-3s, more nuts, more fish oils, more flaxseed. That helps against dehydration of the eyes. If you are healthy from 18 to 65 years old, you should at least have a comprehensive eye exam every 2 years. If you have been diagnosed with any systemic etiologies, such as hypertension, high cholesterol, diabetes, autoimmune disorders, you should be seeing your eye doctor more frequently. We must emphasize again, not smoking, UV protection, so that you use polarized sunglasses against UVA and UVB rays. You must use the blue blocker lights when you're using electronic devices, or I should say blue blocking spectacles that can protect you against the blue light that is being emitted by digital devices. Once again, great diet in reference to vegetables, fruits, fish oils, omega-3s, which are anti-inflammatory, and also flaxseed. Things that are concerning to us when a patient calls, is this considered an emergency versus someone that can wait? Things that are considered emergencies are blurred vision that was never there before, a change in vision that wasn't there before, intermittent blurred vision, floaters, flashes of light, pain in the eye, a red eye that does not go away, intolerance to the contact lenses, fluctuating vision, or call us immediately if you're having any type of systemic crisis with your pressure being too high or uncontrolled diabetes. Those are all signs that you should come in to see us sooner versus later. Systemic health conditions that are related to vision. And it is important when I see a patient and they come in with eye symptoms, red eyes, eye strain, blurred vision. A lot of times I tell them those symptoms are secondary to their systemic health. For example, hypertension and diabetes, they both can cause issues with the circulation, the small vessels that feed the retina. And if poorly controlled, it can lead to retinopathy. Retinopathy means that there is something wrong with your eyes. Your blood vessels can leak, they can hemorrhage, they can induce swelling of vision, swelling of the retina, and that can in turn induce blurred vision. High cholesterol can induce thrombus, embolus, because the carotids, arteries, feed the small circulatory vessels of the eye. And that embolus can present to us in reference to a central artery occlusion. That means ischemia of the eye is not being fed. Or a vein occlusion, which is hemorrhaging inside the eye. Unfortunately, both of those can lead to severe loss of vision, which in many cases is irreversible. In reference to other systemic conditions, we talk about thyroid problems. This is where your T3, T4, TSH, all those levels need to be checked by either your endocrinologist or your primary care physician, because that can lead to severe dry eyes. Also, autoimmune disorders, we are talking about rheumatoid arthritis, lupus, those type of disorders, or any type of connective tissue disease. That can also lead to severe inflammatory ocular surface dehydration.